know until we can go back and look epidemiologically, but it does seem, at least from where we're sitting, that this is helping to keep patients out of the ICU. But make no mistake, this is a deadly disease. If you are impacted by it, and if you are one of the unfortunate ones who has a serious case of it, the chances of you ending up in the ICU and on a ventilator are still very real. So while we're reporting some good news today, we cannot become complacent at all. Masking works, again, so it's no surprise that Governor Ivey has extended the masking order for the state through August 31st. Personally, I would not expect her to rescind it even at that point, and certainly we have got to keep our community transmission low so our children can be in school, so our businesses can stay open. Those are non-medical reasons for us to do it, and also to make sure that your healthcare system has all the resources it needs to take care of you. We've had a glimpse of what happens if we don't do it. And we don't want any more rocket ship spikes. And our goal here is to delay the spikes until after a vaccine is available, or until there is a very good treatment that keeps people from getting so sick with it. So our masks are our temporary vaccine and temporary treatment. Yes, it's hot, and good news is you don't have to wear one while you're mowing the lawn, unless you're mowing with a parade of folks. But I've been asked to talk a little bit about what kind of face masks, and kind of revisit a little bit about the care and feeding of your mask. What kind? Remember, it's got to be a covering that covers your mouth and your nose. It needs to be as thick as you can stand it. The thicker and the tighter the weave of the material, the less can get through it. So a tightly woven cotton, for example, or a two-ply, two layers of material. Does it matter if you wear a buff? Does it matter if you wear a handkerchief? Anything's better than no mask. Most of the studies I've seen have been done with a more traditional mask covering that, like I see everyone here wearing. The second thing is you have to wear it. It does no good if it's in your purse, in your bedroom, hanging from the light switch. It matters if you wear it, and you need to wear it all the time certainly if you're going to be within 6 feet of anybody, and certainly indoors, and comply with our mask ordinances. Have extras. When my kids go out, I ask them, do they have one? Do they have one to leave in their car in case they forgot the one I reminded them to bring? And then also have one to share, a clean one to be able to share if somebody comes into their space, an unexpected an acquaintance that they want to talk with. Keep everybody safe. The other thing is that you have to wear it properly. It does no good if it's not covering your nose. It doesn't do any good if it doesn't provide a good enough cover so if you sneeze or cough, your germs stay where they're supposed to, which is with you. And then you have to take care of it. Remember, when you wear a face mask, the outside gets contaminated with everything else, and the inside gets contaminated with your secretions and any viral particles, et cetera, that you may be harboring. So you have to launder it. You should change it. That's the reason to bring an extra one. If it gets soiled, if it gets wet, the effectiveness declines. So make sure you have extras, make sure you're washing them every day, and most of the mask materials I've seen can be laundered, so just double check that. I'll just make, Public Health asked me to mention one other thing, and that is most of the CDC guidance now has moved us away from a test-based return to work or return to health designation, and the focus is on symptom and time-based strategies. In particular, note that there is no reason to do repeat testing. If you test positive once, then there's no reason to keep testing. And if you test negative once, more negative tests don't prove anything further than you had a negative test. So again, using the symptom and time-based strategy, we get out of this dialogue about when to test and how to test. And remember, too, that if you are going to be tested for a reason that you and your healthcare provider have agreed upon, you must go home and isolate until the results come back negative. It does no good to be tested if you are going to continue to be out in the community. And don't go to work sick, obviously, but we still continue to hear anecdotal reports about folks doing that and while they're waiting for the test results to come back. So great news today, and I'm delighted to have the opportunity to bring it. And Jeff, that's it.
Thank you, Dr. Hudson. Now we'll go to Mayor Paul Finley from the City of Madison.
All right, and thank you, Jeff. And on behalf of Mayor Tommy Battle and the Huntsville City Council, Chairman Dale Strong, and the Madison County Commission and our Madison City Council, appreciate the opportunity to say a couple words today. And again, as Dr. Hudson said, it's good to have some numbers where you can feel a glimpse of change. And, you know, if I go back to a couple of things she talked about, but we always, as we get these numbers, we start doing some really quick math. We have our calls at 11. In this case, it was 11:30 because the governor spoke, and then you start doing some quick math. The good news is over a 2-day period, so from Monday till today, the numbers that we received, the average is only 85%, or 85 as far as the numbers that are going up. The neater thing with that is the quarantines are down 227. So where we've got about a 4% increase over 2 days on new cases, there's a 9% decrease on the number of folks that we're monitoring that are in that window of quarantined folks. So we're starting to see that go down, but to see those numbers negative is great for the community. And on top of that, hospitalizations over the 2-day period are down 4, which is a 2% decrease from 235 down to 231. So all of those numbers show that we're making a positive impact in this, and we need to stay vigilant and stay on that, and we can't become complacent. And I commend the community. There are so many different feelings and thoughts on all of this, but I don't think there's a person out there who doesn't want to see us as a community work through this and get back to anywhere close to the normalcy that we had. So good to have those numbers today. We want to see Fridays continue on that path and continue on that charge as you used with the example of the rocket. I agree with you. There's no surprise that Governor Ivey extended the Safer at Home through the 31st with masking. I think without question from a state standpoint, it was the numbers dictated that continued to happen. And I think even locally, we want to see that continue to happen and stay on that. You know, the biggest thing we've heard out of all of this, without question, is daycare. And I say that the difficulty that a lot of parents feel when it comes to trying to manage working and managing their children. And so I thought one of the things that I would pass along today is a lot of folks are starting to talk about the possibility of monitoring each other's kids and almost having a daycare type facility. You need to go to the Department of Human Resources, DHR. So the website is dhr.alabama.gov. And in turn, you can go to childcare. There's a tab for that. It gives you all the information that you would need as someone who might want to support the opportunity to watch kids. And, you know, I had someone, it's amazing to me how great our community is, who called, and his wife is retired. He's a plumber, and he just said, we have 2 or 3 single moms that live within a block of us. We're going to be in a position to support them where my wife can turn our dining room. We're going to move all the furniture out and help them with their schooling. How do I do it legally? You know, so we have folks in this community that are continuing to look to help and make a difference. But go to that website, dhr.alabama.gov. There's a tab that has childcare, and it helps you understand legally how you accomplish that. Along those same lines, we have employers right now, the City of Madison being one of them, who are in a position to try to work to support these parents who are going to try to find dual roles for this first 9 weeks if you're in Madison County. You know, a couple things. There's the Emergency FINLEY Act that's out there that we as an organization are working with, where folks can take some time. There's about 2/3 pay that comes with it, but there's ways to work with those employees. Along those same lines, we're talking in some instances about different work schedules, ways that you could come in from, say, 6 to 2 instead of a normal time frame. You know, in city government, that doesn't always work. A police officer, a fireman, a public works facility person can't necessarily do that, while others could. And I know employers out there can continue to try to help their employees through situations like this. Telework continues to be something that a large majority of our community can do. As a matter of fact, that's why so many folks talk about the beauty of this community is we're getting things done in many instances while staying separated and at home. And then a lot of times, in our case, annual leave. You know, there's different ways that folks can use what's happened and what's accrued. And, you know, we can look to do that. You know, one of the things I will be the first to say is in city government, so many times Everybody, in many instances, I call it the swivel head. They're constantly looking to see what somebody else is doing. And well, they're getting it, what about me? I just hope that as we work through this, that everybody understands that the goal is to work as a community to help each other through this situation. And in some instances, somebody else may be able to do something that you don't need to do. I have three sons, 21, 24, 27. They're capable of managing it themselves. I don't need to do something different at this point. While others have a 3, a 5, and a 7-year-old, they desperately need a way to support their family in different ways. You know, it's not always about fairness. It's about survival and doing the right thing for this overall community, and I hope we continue as a community to do that. You know, one of the things that we saw yesterday is the impact that it has on businesses, nonprofits, and the Space and Rocket Center is a perfect example. I will say that as they talked about, they're very open as far as the needs that they have. They've set up a GoFundMe page that's, I guess it's hashtag Save Space Camp, and this community can go and support them. I will tell you that, you know, from a municipality standpoint, talking with Mayor Battle, and I didn't talk to Chairman Strong this morning, but I do know, you know, from a municipality standpoint, the Space and Rocket Center is one of the organizations that we support in the city. I know Huntsville supports them in a much larger way with outside appropriations, outside funding appropriations. So we will look from a city standpoint, both in Huntsville and Madison, but we're in the budgetary process. So it'll be in a position where we try to figure out how to support that organization, the #1 tourist attraction in the state of Alabama, and you can start to see the impact that it has when people can't get together with people. But I also have, you know, and I'd be remiss if I didn't mention, there's a lot of nonprofits out there right now that make a difference and pick up this community in ways that we in city government can't or aren't responsible for. And so as you're out there and as you can continue to make a difference in either volunteering to help those organizations, helping to fund those organizations, let's keep all of them in mind. That's what truly makes a difference in our community and makes us so great. And then I wanted to give a specific example because a lot of times we talk about enforcement. How is this getting enforced? I had an email that came into my office about 11 o'clock yesterday, and it simply said, and I won't name Lowe's is there's nobody's masking there. What are you going to do about it? There's no masking. Well, we sent our folks in this morning, and I can just tell you that I just read an email of the 250 to 300 people that were in Lowe's. 3 people didn't have masks on, and 2 of them were leaving the outside home and garden area. The one person that didn't have their mask on, we simply asked them to put it on, and they had no problems doing that. Every employee had a mask. They had masks available in the front, and they complied in every way that they could, even with announcements. Sometimes what we read isn't necessarily what is the truth, but I will say we take it very seriously here in the city, in every one of our organizations. If we can do something that makes sure that we're monitoring this, to make sure that we're all doing what we need to do. So it's a great success story in my case. When I read that, I recognize, and you know, I've gone to restaurants, I've been to Kroger. People are doing what they're being asked to do. We can see in the numbers that it's starting to make a difference. And I'll end by just saying 2 things. One, you know, if you have tested and been and gone in for a test, please stay quarantined until you get your result. That's internally in your house, but also, you know, or with your family, but also your house. And then secondly, let's not become complacent. Let's continue to work together to make a difference in this community. I think we've done a great job so far. You can see a little bit of light at the end of the tunnel. We know that could change by Friday, but let's certainly hope when, I guess, Chairman Strong comes up here on Friday, that he's able to talk about these positive numbers going in the right way. Let's keep working to make that happen. With that said, Jeff, that's all I have.
Thank you, Mayor Finley. And thank you for watching today. We'll be back here again at noon on Friday, July 31st, for another daily briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As you come to the mic, please identify yourself and who you're affiliated with, and we'll allow 1 question and a follow-up.
Kate Smith, 48 News. This one is for Dr. Hudson. So I know we obviously don't want any cases here, but with the mask mandate in effect for almost 3 weeks now, more than 3 weeks, as a physician, were you expecting to see lower numbers, or was are these numbers right where you guys were expecting to see?
The trend is what we're watching. We know that there will be cases because the virus is out there and we have vulnerable people. The other thing we know is that the virus can infect someone and they can be infective to other people and that can feel perfectly fine. That's why the masking was so important, because you don't know all the time if you could spread the virus. So from the standpoint of going to zero, I don't expect us to be at zero. And what we're trying to do, though, is lower the transmission in the community so that we can get back to doing the things that our community needs to do, educating our students, keeping our economy open, being able to socialize in responsible ways that keep us from making each other sick, and then creating so much disease at all the same time that it overburdens the healthcare system, and everyone can't get the kind of care that we would want simply because of the huge influx that could happen if we don't and weren't. And certainly our numbers have demonstrated that it can get pretty bad pretty quick. But the good news is the masking strategy works, so we can also get pretty good on a predictable scale.
Great. And then my follow-up question is for Mayor Finley, a little bit off of the Lowe's situation. I reached out to some of the, the jurisdictions in the area about citations, and none of them have given a citation since the Madison County mask man order has been in effect. Do you think that's because people are following it, or the officers aren't enforcing it that way?
I don't think it's that they're not enforcing it. I do think most folks are absolutely complying with what they are. And just like today, we go in and we've always said we're going to be consultative. And so we don't always just wait for somebody to send us something. They're going out on a daily basis and going to these businesses and organizations. And for the most part, they meet all the requirements. And if they don't, we very easily can just say, what about this? What about this? And they're willing to comply. They want to stay open. They in almost every case, it's what else could we do that would make sure that we comply with what you're asking for and we can stay open. And the longer that they stay open and are doing what we're asking them, then obviously more people have jobs, and in turn it's making a difference for that business owner that's made a big investment.
Great, thanks.
Sydney Martin with Way 31. My first question is for Dr. Hudson and for Mayor Finley. So we've all talked about it. The governor is keeping that statewide masking order in place through August. She said there's no plan on restricting business openings. So Huntsville and Madison, we've heard similar things recently. Obviously, there was a shutdown in April and May of businesses when we hardly had any coronavirus cases here. There's now 81,000 cases, which is more than a quarter of those were reported in the last 2 weeks. Madison County has more than 4,500 cases, and more than a quarter of those were reported in the last 2 weeks. There's still no medicine, no cure, no vaccine. So why is it safe and okay to be open now when it wasn't then, and what's kind of changed?
At the beginning, when we were first wrestling with the onset, which, as we probably know now, it was in the community longer than we knew that it was a time for us to try to avoid an immediate spike when the resources had not been put in place to be able to respond to something. So to flatten that transmission curve meant safe at home. In New York City, you saw the antithesis to that. That was what every community in the country was trying to avoid. And certainly we've had hot spots like that around the country, and we had our own little taste of it started a couple of weeks ago. We're trying to keep the transmission flat. That is success. We need to keep it flat until there is a vaccine, and there are several trials that are making their way through perhaps some opportunity for a vaccine as early as the December-January, based on some of the information I've read. Is there a treatment? No, not one that's specific, that if you take it you can keep from getting the disease. Nothing I've seen out there. So meanwhile, our biggest tool are you can tell me, masking, social distancing and sanitizing. And that is what has resolved almost every plague of humankind. I was reading the National Geographic last night, and it laid out all the plagues since historic times, and with the occasional few that are related to flea and rat transmission, it really all came down to people separating and being very careful about the distancing.
Yeah, and I don't know if I think Dr. Hudson said a lot of that. I do know this, that, you know, if you think how long the governor went in the initial pieces of having most businesses closed down, the feedback that she received and about the time that she finally opened, in essence, the state back up at the level it is now, was that's about as far as I can go with so many of these smaller businesses that aren't open. You know, the individual services type businesses that just, you know, we're to the point where we've got to open. And we've always talked about the balance of health versus economic health. And so when she opened that up, you know, we didn't see dramatic results, but then as people started to get together with people, we started seeing those numbers go up. I think what she's doing now, and she said it today, the economic health of the state is still critical, and she's trying to continue to find that balance. Now, if you look at numbers like you were talking about, you know, I looked at the last week. So being here Wednesday to Wednesday, you know, the state was up 16% as far as cases, and the community was up 20%. And yet you look in the last 2 days, it's 3% and 4%. So we're starting to see, hopefully, a change not only statewide, but locally. And I think the balance of it is, when you say, is it okay? I think she's just continuing to try to keep every business that she can open while still keeping people as healthy as it is, without question, a pendulum that goes back and forth. And I think right now she feels like I'm in a position where we're going to start to see it go down. As with any other governor that's out there right now, they're going to continue to watch numbers, and data doesn't lie. And so if we get to the point where we can't continue on that process, then she's going to have to make another change.
And then for my follow-up, Mayor Finley, if you'll start, and then Dr. Hudson, if you'll answer second. So high school sports, we've been asking a lot of the community leaders about their opinion on it. I know you've talked about your 3 boys. They're obviously not high school age anymore, but at one point they were, and I'm sure they probably played sports. We've also heard you talk about your mom, who is high risk. Mm-hmm. If your sons were in high school, would you allow them to play sports during the pandemic? And do you believe playing high school sports is safe? And then Dr. Hudson, your opinion on those 2 questions. I'm not sure about your family situation, though.
Gosh, that's you know, and I say it's a hard question. It's not, in one sense, just because of the passion I have for and the hurt that I have for any child who misses any part of a senior year or a sports program, or is in a position right now where they have a chance for a scholarship, but they need to, you know, be where others can see them. And yet health is critical. If you ask me personally, I would ask them to take. I would be a part of letting them and allowing them to do that, knowing full well that it may not happen for that long time. My niece right now is a volleyball player in her senior year at Radford University, and I watched a child. She was down here this summer doing an internship, and she lived with me. Beautiful girl who is the leader of that team, who just cried when she realized that there's a chance that they might not be able to play. So I think there's such a balance. But if you ask me personally, I would do everything I could to allow them to play, as long as the coaches and the teams were doing what they could to keep them distanced. But I would also fully respect, as I do with our school systems right now, that sometimes they have to make decisions that don't make everybody happy, but keep as many people as they can healthy, and I would respect that. I think some of them have chances versus others, and I think they're trying to do everything they can, just in the sense of the same with economic balance versus health. I think they're doing the same thing in the schools with losing an entire, you know, fall season versus, you know, keeping kids together. It is a balance that, you know, goes back to decision making. And you heard the governor say it today. When you're in a position to make those decisions, they are really tough decisions. And you use data and listen to professionals tell you that. But that's how I would be making decisions, and we continue to do that. But as someone who's watched kids just bawl because they aren't going to be able to do something that they love and passionately enjoy doing, it is a struggle. But you know, that's part of the decision-making process.
I have a a rising senior athlete, double sports. So this fall, she's running cross country. I've met with the cross country coach who has a fantastic plan. I don't think there'll be any issues with that team. She also plays travel soccer, and they are operating under a series of rigorous rules that, if they are followed, I'm confident it is as safe as could possibly be. And as with everything, if you don't follow the masking, the distancing, and the sanitation, then the system can break down. I also have another daughter who's going back to college, and her college released pages of requirements and conditions and rules, and will they work? Yes, they probably will if people follow them. So it gets us right back to the conversations we've been having here, which is masks work, but not if you leave them in the car, hanging on the light switch in the bedroom. You've got to wear them, and it will prevent disease.
Kelly Smith with WHNT News 19. Nursing homes and testing in nursing homes continues to be something that is top of mind for a lot of families, especially for those who maybe haven't seen their loved one since March. We've learned that the Centers for Medicaid is sending rapid COVID-19 test machines to nursing homes in the state in Lee, Montgomery, and Jefferson counties. I have a kind of a two-part question for you. First, what is the benefit of having that rapid testing machine there in a nursing home to be able to give results so quickly? And then in addition to that, what is being done in our community to push to get those machines in our area? And that is for both Dr. Hudson and Mayor Finley.
So those are probably the two hardest questions. The most vulnerable populations are those that are aged, who have other comorbid conditions. And very often those citizens find themselves in an enclosed population where if left to their own devices, they would stay disease-free. But essential workers have to come in and help. Family members want to visit. And so the virus being in our community is going to make its way into those vulnerable populations. From everything I've seen in our community, our skilled nursing facilities and other group type settings have been doing a good job. We have not seen the kinds of things that we've seen in other communities where an outbreak occurs and 6 or 8 or 10 patients have to be admitted to the hospital because of an outbreak. So I think our county facilities are doing, and the surrounding counties must be doing pretty well. Nothing is perfect. The machines don't cure the disease. The machines are a tool to help those administrators figure out how much disease do they have, who is positive, who is not, so they can separate those patient populations, just as we've done in the hospitals. Is that you want to try to keep the well people well, and the sick people need to get the treatment that they need to get, and to keep from passing it back and forth. So that too is a delicate balance. This is a day of balances, and I think that we immediately know when there's the lack of success, and it's not necessarily attributed to anything, but a healthcare worker or an essential worker for a nursing home goes to work, was feeling fine when they left home, but remember, they could be asymptomatic and infective, and they don't even know it, and by the time they get sick, they've had contact with not just their normal social contacts, but they've had contacts with other patients that are in those institutions. So it is difficult, and the tests will help. Are they going to solve the problem? No, that's why we have very smart and gifted administrators that have to balance that and figure out how to make it work.
I'll just add real quickly, I think a couple of things. One, I continue to be very impressed with Sheriff Turner, Chairman Strong. The jail, is a perfect example of people constantly coming in and out, but they've had a strong procedure in place to minimize, the impact and the possible spread of that. And then I do know a perfect example would be assisted living, where folks are putting procedures in place where before you even come into that facility and you're going to be there, staying there, you know, as a you have to take a test and make sure that within a window that you're COVID free before you would come in, as Dr. Hudson said, because one person gets in and then it starts passing around. So I think, you know, and it's almost knock on wood because you want to keep it that way. Folks are doing, just like the businesses, they're doing a really good job of putting procedures in place to minimize the possibility of a larger spread, and we hope that it continues that way.
Is anyone in our community from the Madison County area been in contact with the Centers for Medicaid or is working with ADPH to push for getting rapid testing for the rapid testing machines for nursing homes in our area? Is anyone advocating for that on our community's behalf?
Well, I'll say that has come up from our local or northern region Department of Public Health. You know, they really kind of handle that stuff, but you know, we have been told that they're looking at that. I don't have any confirmation whether our local nursing homes have that testing capability yet, but it is being looked at.
Thank you.
Paul Gaddis from AL.com. This is for Dr. Hudson. As you talk about, I think you said the great news about the declining cases, which I know everybody's thirsting for great news when it comes to the virus, but how do you, I know you've alluded to this, but how do we avoid that complacency? How do we avoid relaxing to thinking, okay, we've got this virus on the run, we got it under control? Because, as you've talked about, it can spike up as quickly as it can slowly go down.
Every one of us has a personal responsibility to kind of watch the numbers and be responsive, and I think that's having a good way to measure, and I think we're getting better at understanding the predictors. It is good news, and good news these days I would categorize as great. You know, we're looking for anything that is reassuring that if we do X, Y is likely to result. If we wear masks, our transmission rate will drop like a stone. And I think that we're at a point now where that's, to me, that makes just the fact that it's declining makes that great news. We did it. It's responding, and we're getting down. Hopefully, we'll soon be back down to our baseline transmission rate. And how does any coach keep a team engaged and aligned if they're up by 3 points? I would say at this point that we're more like a tie, and we've made it down the field and we're in striking distance. So it is. It's going to take leadership at all levels in our community, and we're going to look to the media to help keep that positivity and encouragement going. It can't just come from one place. It can't come from just an ordinance. It can't come just from public health. We have to all believe it and execute it in enough. Just like vaccination, 100% of children don't get vaccinated. But studies have shown that there is some baseline percentage that if that number, if that percentage are vaccinated, we keep the spread of the childhood disease at or near a very minimal amount. It's the same thing. 100% of people don't need to mask, but enough of us do so that we can keep that transmission rate and we can watch it. Now we know what we're looking at in terms of 3-day increases in cases, and so we should be able to tweak it. The masks are going to be around, I think, and should be until we have a permanent solution, which would likely be vaccine. And when we have a vaccine, will we have an uphill battle trying to get people to agree to take it? So mask, vaccine, okay, pick one. But we're going to, community leaders are going to need help to make this be a sustaining opportunity for our community.
Follow up, I want to ask Mayor Finley. You made reference to the Madison County Jail and the success story that it's been there. Could you expand a little bit on that? I mean, do you have any numbers about how many positives they've had or anything like that?
I don't have that, and I guess part of it is we just, you know, part of the beauty of it is we haven't heard about it. You know, if there was bad news, you know, and they had to give that bad news, we'd heard about it. I think the fact that we haven't is such a positive for our community. And sometimes, you know, we miss the things that are quiet. But no, I don't have any numbers along those lines. I know Chairman Strong can probably give those on Friday. But I do know from a Madison standpoint, because we house our folks at the jail, there are strict requirements that are in place if someone is going to be housed there, to keep them housed there, and even to let them in. Yeah.
At this point, we'll conclude the press conference. Thank you for coming.